My name is Charlene and I'm the registered dietitian at McKenzie Health Systems. And today we're going to be talking about diabetes prevention to honor National Diabetes Month, which is the month of November. This is part of the Lunch and Learn series and was scheduled for November 17th, but we're coming to you virtually because of the COVID virus. I will be co-teaching this instruction with Sandra, who will be coming to you from an RN perspective. I'm just going to give you a very brief background of some things you can do as far as diet alternatives. First, I did want to introduce this wonderful book. This is Food Lifts for Diabetes, and it is available to you, and I would highly recommend that you call and order one. It is from the American Diabetes Association. You can order it online or you can call 1-800-DIABETES. It's $3.89 and it's a wonderful, comprehensive booklet that goes through each different food group. It tells you how to read a label. It gives you combination foods. It gives you convenience foods. And it tells you what a proper diabetic portion of that food would be. And it's based on the glycemic index of a food, which is very important to diabetics because that determines how fast your blood sugar will rise based on that food. So foods sit in your stomach, and if they're digested very quickly and they have a high glycemic index, they will leave your stomach quickly, get into your bloodstream, and spike your blood glucose high. You want to try to avoid those type of foods, and you want to have instead a slower release of glucose into your blood system so that it's better controlled. There are 5 foods that are notorious for spiking up your blood glucose. Those are the 5 white foods: white potatoes, white rice, white pasta, white sugar, and white flour. You would be better off doing a colorful alternative to all those white foods and only eating those white foods very sparingly or not at all. For instance, eat sweet potatoes or yams or squash or any other starchy vegetable like corn or peas rather than the white potatoes. And if you do eat white potatoes because you're just craving mashed potatoes, a lot of people will get cauliflower and chop it up fine. You could actually buy it already chopped up in little rice looking like pellets, and they add that to the potatoes. So really you're making half of what the white potato would be. You're adding a very low calorie, nutrient dense vegetable to that, and you're really not altering the flavor very much or the appearance or texture. So that's something you could do with the potato. For the pasta, you can buy the whole grain pasta, which is different in color. It's brown, and it is a little heavier, and it is an acquired taste. You kind of have to get used to that. But there's another alternative, and it's called Dreamfields. It is a salmonella pasta, just like your normal white pasta, but it has the glycemic index of a vegetable. So rather than being 15 grams of carbohydrate per serving, it's only 5. And they do have that at your local store. It comes in a black box with red stripes, and it's called Dreamfields. And it was marketed and produced with the diabetic population in mind, or people that wanted to lose weight in mind. As far as the white flour, get the whole grain finely milled flour. You can cook with it just like what you would white flour. It's not coarse or textured. It's very finely milled, and you're getting the benefit of the entirety of the grain and more fiber. White sugar is something that there's really not an alternative to. They do have stevia that's out on the market now, and that's plant-based. It's an old, ancient, it was around during the Incas and the Mayas, and it's been around forever, and it's actually a plant. and it's a sweetening agent and it's wholesome. So you could use stevia, and a lot of the industry is using stevia instead of Splenda in their products now as a sweetener. Also, the Crystal Light type things, that little sleeves that you add to your water, a lot of those are stevia based now, rather than a chemical that is manufactured in a laboratory. Stevia is a natural sugar alternative. And the last one would be rice. Instead of the white rice like you get from a Chinese restaurant, you can get a whole grain rice. It doesn't necessarily have to be a wild rice or a very meaty, chewy rice. You can get the regular brown rice, and it will take longer to cook. So typically, if you do go to the Chinese restaurant as a treat, you could bring home the rice, but pretty much throw it away. Send somebody to get the Chinese food, and you could stay home and cook your brown rice up so that when the food gets there, you have a wholesome alternative to that white rice, which would really just be spiking your blood glucose up. So remember the 5 white foods. The other thing is, alternatively, keep your diet very colorful so that you have a lot of different vitamins and nutrients that are interacting in your body and in your diet all the time. So mix your fruits up with blueberries and raspberries and blackberries and kiwi and strawberries and muskmelon. Don't always just go to the traditional apple, orange, pear, banana. Make everything colorful. The same thing with your vegetables. So that's the 5 white foods. In the glycemic index, you can get books that specifically give you glycemic index of foods, but don't get too bogged down with that. Just get a book like this, order this one or something similar to it, and it's really all you need to get you through. It has information on how to read a food label, and it has recommendations on portions for diabetics, which I'll just show you this. Tells you what is an ounce, what is a quarter cup, what is the equivalent to half a cup, and it just uses your hand as an alternative measurement. Sandra will be talking more about the specifics of diabetes from a nursing perspective. She'll get into the My Plate as well. My Plate is also in the book, and it talks about half your plate being fruits and veggies, a quarter starch, and a quarter meat. And this would be an example, 3 different plates. And again, it's all inclusive in this comprehensive book. So with that in mind, I will turn the mic over to Sandra for her portion of the instruction.
Welcome to the diabetic series that I am teaching with Charlene. And my name is Sandra Martin. I am a registered nurse for McKenzie Health System, and I also work for the County Council on Aging. So if you're ever in a need, you can call the county. And I'm going to talk a little bit about diabetes and just the basics. We're not going to get into too much detail, but I'm just going to go over the basics. So maybe you might look to see if there's some symptoms that you have been experiencing that you might want to talk to your medical provider about, that you may have signs and symptoms of diabetes. You may have it in your family. You may want to think about what is diabetes and what do I do about it. So the basics is it affects every part of your body. And you want to be aware of changes in your system. It can affect your heart. It can affect your mind as far as causing a stroke. It can cause your eyes to change and go as far as even some blindness. It can affect your kidneys, and you want to be aware of any changes that you may be seeing in the symptoms of your body. It can also, if you don't recognize symptoms, it can develop quickly, or it can develop over time. It just depends on where you're at as far as having the signs and symptoms of diabetes. It could cause a sore to come up and not heal, and you're not recognizing that it could be a sign of diabetes. And if it's not taken care of well, you could have an amputation of a toe or a foot, and sometimes it will go up to even the legs. So you want to be aware of changes in your body. You want to know how your body is operating, how you're feeling at all times, and notice those changes and try and do something about it. It is a silent killer sometimes, that you're not recognizing these changes, and it could cause death if it's not treated. And it has been nationally known, and that people that are 65 years and older are falling into a 46 to 51% in the United States of having diabetes. That's quite a bit of people having diabetes and not recognizing it. And those that do recognize it are probably being monitored for it and not maybe taking care of it properly. Charlene had talked about the proper foods to eat, which is very important. Maybe they're not thinking that it's necessary when it really is. And there is blood work also that can be done. And generally they do this blood work on your routine yearly exam, and it's called the hemoglobin A1C. And a hemoglobin will tell the doctor or your primary care physician where your levels have been with diabetes for the past 2 to 3 months. And they will know if you have been experiencing changes in your system. And there's going to be a list of questions that they're probably going to ask you. And just so that you're aware of some of those symptoms that you could be experiencing, I would like to go over some causes of low blood sugar. And this would be increased exercise, physical activity, and you skipped a meal, and it's going to drop that blood sugar because it's using up that in your system, because you need to have a certain amount of blood glucose to be able to think and run and do your work around home. And the other thing would be eating less food than usual. Some people go on a diet and they think that, oh, I need to lose weight, and they're not doing it properly. So you're losing weight and you're skipping meals and you're not getting the nourishment that you need. Your blood sugar is dropping. Alcohol. Alcohol is being increased in the older generation, and it's because that we're in a time of our life that some of us are alone now because maybe our spouse has passed on, or maybe our health is to a point where now we're hurting and we want it just to stop, and we get into things that we shouldn't be overusing. Another thing is the type of food. It's not balanced. To remember what Charlene said before I came, balance those meals, eat the proper foods, watch those 5 whites that she had mentioned. And then timing and dose of medication, which is very important. And you want to stay on time for that medication. You want to make sure that you're taking the proper medication. Sometimes it's not the right medication. And if you're keeping track of your glucose and you're doing your glucometer and you're checking what that blood sugar level is, it's not working. Maybe it's not always the diet. Maybe it's not something that you're doing that you can tell your provider that there's a change here, it's not working. So these are causes of low blood sugar. This here is blood sugar levels. The too high is above 180. Now that's when you're waking up in the morning, you're checking your blood sugar, and it's 180. That's way too high. And then the acceptable is between 70 and 130. That's checking your blood sugar first thing in the morning before you eat any foods. Sometimes drinking water can even alter changes in our system. Too low would be below 70. Sometimes for people it's 60. You know your system better than most people. But please keep these numbers in mind because they will affect your low blood sugar. Now I want you to remember there's also high blood sugar, and it's called hypoglycemia. And these are some of the symptoms that you can experience. There's a long list, but we'll go over that quickly. I have it up on the board so that you can probably recognize it as I talk. And I want you to remember that diabetes is a long-term complication. And like I said, it affects every part of your body, your eyes, your heart, your kidneys. So just be aware that if there's any changes, you want to contact your medical provider. Some of these are, we're looking at the word caution. So in caution, it's going to be constant urination, abnormal thirst. You need to drink water, but abnormally, if you're drinking and you're just feeling thirsty all the time. Unusual hunger. Sure, we have an appetite sometimes it's out of control, but this is unusually hungry. Oh, I just can't get enough. And it happens more than one time. And the rapid loss of weight. You might be trying to lose weight, but all of a sudden you're dropping 10 pounds like in a week, and it's like, oh no, what's going on? Keep that in mind. Irritability. You know, when we have too much of something in our system, it doesn't always have to be the blood sugar's high, but there's something changing when you become irritable and it's not normally how you are acting. It's not right. The other one is an obvious weakness. We become weak when we are either too high and we're not operating correctly because we're not thinking clearly, or if the blood sugar is too low, you can also become weak. And then we're having nausea and vomiting because all of a sudden our system is out of kilter here and our body is reacting. And one of those ways that it reacts is it causes you to get nauseated and sometimes vomit. Not all the time, but mostly you have the nausea. And that is your caution. Diabetes is also a part of that, but that's when it's getting to the point where you probably want to now call either somebody you know or you want to call 911. Okay, you're getting drowsy, all right? Drowsiness is not a normal thing. Being tired and sitting down, but drowsy and falling asleep all the time is not normal. Itching. Sometimes when we have a buildup of something in our system, our skin reacts and we start to itch and we're scratching. And I have seen sometimes where there's been blisters that has been left on people because it's usually the upper arm or it's down here on the thigh, but it's leaving some blisters. So if you're itching and you can't control that, there's a family history of diabetes. And you know that, and all of a sudden you're showing all these symptoms. You want to let somebody know before it's too late. You're getting the blurred vision, now it's affecting your eyesight. That's not good. You want to make sure you let your primary physician know that. Excessive weight. Now instead of losing weight quickly, now you have this excessive weight because you have been hungry all the time, and now you're starting to gain this weight. You have tingling and numbness in your feet because now you're getting a buildup of this glucose in your system, and it's causing the blood to flow differently, and it's thickening and it's not flowing right, and all of a sudden the fingers start to tingle because the blood's not going where it needs to go, and the feet are starting to tingle because it will go to the part of the body that is not being used that much. The blood flow, oxygen has to go to your heart, has to go to the kidneys, it has to work those organs, but not so much the fingers and toes. That's why you're going to feel that numbness in all of those areas. That's not a good sign. The other one is easy fatigue. You get tired really easy. And the last one is the skin infection and slow healing. That was what I said in the beginning, where amputation comes in and you have that slow healing going on and you don't know why. Maybe you did have this itch and you scratched your arm or your leg. Now it just is not healing, and it's not healing, and it won't go away. Please get in touch with your primary care physician. You could be having high blood sugar in your system, and it needs to be controlled with medication. So now that we've covered the high blood sugar and the low blood sugar, and maybe you've gone to see your primary care physician and you know that you have diabetes, or maybe not. So how do we treat that? Steps for treating low blood sugar. You want to check your blood sugar. If you're already a diabetic, you probably have a glucometer. So check your blood sugar. Let's see where it's at. Remember those numbers. It was between 70 and 120. So you want to make sure that that's in there. Now, if it's about 180 and it's been 2 hours since you've eaten, it's still too high. So you want to eat a remedy of sugary food. So that's going against what our little lady said, right? She said that you got to watch that sugar. This time you want to drink some orange juice. It has the sugar in it, okay? But only because it's low. Your blood sugar has to come up quick or you're going to probably pass out. So take maybe 4 ounces of orange juice. Recheck your blood sugar in 15 minutes. If it's still low, you can add a teaspoon of sugar to that orange juice. You want to get that blood sugar up as quickly as you can, because sometimes it will drop down to 50, 40, 30. When it gets that low, you can no longer think, and you're going to be passing out. And hopefully somebody's going to be around to help you get the assistance that you're going to need. Before you get to that point, let's try and take care of it. The next thing is, after the 15 minutes and symptoms are not any better, and there's no change in your blood level, you've repeated these steps a couple of times already, and it's not doing anything, you want to contact the doctor, all right? If it's too low, like in the 40s, and I've seen that happen, because remember, I have been a nurse for quite a while, and I have seen it happen very often. I've gone into someone's home, and thank God that I've gone there, because they were not able to get the help that they needed. So make sure you call 911 if you feel that you need to get to the emergency room immediately, or call your primary care physician. And you want to make sure that you eat a meal after you do that. Say that you did check it, it's coming up to normal now. Now the best thing to do is have a piece of protein. You need to eat some protein. I know our little lady talked about cheese, but cheese is a good thing right now to have to help that protein, or some milk. You can do some low-fat milk. We don't need to have the high fat. Peanut butter is also good. That's a protein. But just a little bit goes a long way. I'm not saying to eat a half a jar or a whole cake of cheese. We don't have to do that. Just a little bit, and it's going to bring it up, and it's going to help it stay in a normal level over a longer period of time, because that sugar is going to bring it up. You're going to get it burst, it's going to come up, but then it's going to drop. To level that out, you want to have a meal. You can have a half of a turkey sandwich. But just get some protein into your system. And then you want to recheck that blood sugar again in 15 minutes. Make sure it's staying level. And then you want to recheck it again in an hour. And make sure that it's maintaining the level that you want it to be at. All right. Now you have called 911, or you have received back that your blood sugar is normal. Now what do? Now we're going to look at our medications. We're going to see if everything is the way that we need to do it. The purpose of your medication is, first of all, you want it to relieve those symptoms. Is it making you better? Is that medicine that you have been using over time still where you need to have the levels kept? You want to prevent further problems. Remember, diabetes affects the whole body, the heart, the kidney, the lungs, the arms, the legs, everything. So let's make sure that we're going to prevent further problems like blindness, a heart attack, kidney failure. You don't want to have any of those. Amputations, and ultimately death. We want to improve the disease or slow its progress. Remember, diabetes is a long-term disease. It can be controlled if you have type 2. Type 1 generally is a problem with the system. And the doctor can go into that more in depth with you. If you do have type 1, you're probably on an insulin. You're probably going to be on insulin the rest of your life because there's a part of your body that's just not producing that insulin, and it's called the pancreas. And like I said, the doctor will talk to you about that. But if it's type 2, we can control it, and sometimes the numbers are at the level where it's like it's in regression and it's leaving us. You always have to be aware that you are a diabetic and you still have to monitor what you do. But you can have it so under control by listening to how Charlene has encouraged you to eat that you no longer may have to take the medications. Or sometimes they add insulin to medications even when you have type 2. So it can be controlled, not only with the diet, but also with exercise. And we want to replace substances the body normally produces. So the body normally will produce different types of problems in our system when the glucose is high or low. And you get different, that's where the heart attack comes in, the kidney problems, and other problems in your body organs. I'm not going to go into those because they're medical terms that you're probably not even going to recognize or even remember. But just know that you need to talk with your doctor and you need to get yourself in control of taking care of the diabetes that you possibly might have been diagnosed with. Or maybe you know somebody that already has diabetes and you want to help them out. We're going to continue about the medications here a little bit, and medications responsibility. It's going to be your responsibility to take that medicine and to do what the primary care physician has encouraged you to do. Or maybe you've had someone stop by your home to do some diabetic education. Or maybe someone at the doctor's office has been taking the time to talk to you about your diabetes. Take responsibility. Inform all of your health care providers, and today we have multiple of them. It's not just the primary care physician anymore. We have a cardiologist, a pulmonologist, gastroenterologist, and I can keep going on and on and on of all these ologists, but you probably have 5 or 6 of them already. So let them all know, because they need to know that you're diabetic and what medicines you're on, so that their medicines that they're giving you isn't going to conflict or cause it to go up or down, which can happen with different medicines. You want to discuss the need of each and which is most appropriate. That's important too. Remember, when we were going over the portion of high blood sugar and low blood sugar, is the medicine working? Let them know what your readings have been. Maybe you can monitor your blood sugar for a month in between the time that you go and see your physician or your nurse practitioner, whoever it is that's treating you. Maybe you can take that with you to your office visit and show them, this is what's been going on. Talk to them about the foods you've been eating and the exercise that you've been doing, and it's not working. So let them know. Use the medications as prescribed. You want to take it on time. It's very important because our body reacts to that timely medication with the food that we eat. It all works together. Sometimes you got to take it before, sometimes you have to take it with, sometimes you take it after. It just depends on how the physician is treating that diabetes of your specific kind. You want to report any effects of each medication. Sometimes you're going to have a side effect. I know people that can't take some of the diabetic medicines that they've been put on. There's so many different kinds. I did a research before I did this program, and my goodness, I can't remember them all. I know you can't. So if the medicines that you have are causing a problem that, oh gee, I started taking this maybe a couple days ago and all of a sudden I'm having this happen, let the doctor know. It's not normal. You wanted to report if not taking as prescribed. How are we going to do that? Well, we got to take responsibility and let them know, I haven't been taking it. That's why things aren't going the way it is. So either help me get to where I need to be responsible, or give me something that's going to work. Because they have different types of medicines. They have the kind that they can put on you. It's an insulin pump. They have medicines that you can use nasally. They have the oral medications, but it has to depend on the type that you have and what is working for you. Make and carry a medication list. You want to always have on hand what you're taking. And if you are a diabetic, it probably would be best if you would get one of those wrist bracelets or something that's on the chain that you could put around you or hook it onto your clothing to let them know that you're a diabetic. Because maybe you're shopping and your blood sugar drops slow all of a sudden and you happen to pass out. Somebody needs to know to get you the help that you need so that you can be healthy quicker instead of them trying to guess. And use the same pharmacy. How many times do we shop around and we're trying to figure out, who is having a sale today? Well, we don't want to do a sale on medicine. You want to get your medicine either through the mail with your medical provider that you've been dealing with, or check with the pharmacy that you want to deal with, and stay with that pharmacist. If you have questions, they know what you're on. You can even call them and they can talk to you over the phone. They can let you know about the medicine. And you have a one-on-one with that pharmacist, with the pharmacy, and you are aware of how this medicine is going to work. Because not all medicines are made through the same company. There's generics and there's name brands. So stay with the same medicine, stay with the same pharmacy. And if you have any questions, please always direct it to the primary care physician. Now, I hope that this has helped you to encourage you to take control, try to eat the foods that you need to eat, tell your primary care physician what's going on, monitor those signs and symptoms and know the changes. And last, I would like for you to take part in your life. You are in charge. You're the only one that can make those changes. You're the only one that can say, okay, I'm worth it. I'm going to make that change. You want to prepare. You want to track what's going on. Maybe you have to keep a food diary. You want to report to your family, to your friends, to your doctor. You want to make a list. That list is for your benefit, for the household's benefit, and the doctor's benefit. You want to ask the questions. Write them down in between your visits if you're not going to remember. And you see something's happening and it's not an emergency. Please write it down. And you want to repeat. If they're not hearing you, and there's no changes being done, When you go to the doctors, you go home, you try it again, it's not working, keep repeating it. Make sure that somebody is hearing you and take action. You're the only one that can eat that food, that can take that walk, and they can take care of you so that you can control your diabetes and be the best person that you are.